What is kidney infection? A kidney infection is a kind of UTI, urinary tract infection. A kidney infection can originate in the urethra, the tube that drains urine from the body, or in the bladder. The infection could spread to one or both kidneys. A kidney infection is also known as pyelonephritis. A kidney infection requires early medical attention. If not appropriately treated, an infection might cause long-term kidney damage. Alternatively, the germs might migrate to the bloodstream, causing a serious infection. Antibiotics are frequently used in the treatment of kidney infections and may be administered in a hospital setting. What are the symptoms? Symptoms of a kidney infection might include fever, chills, a burning feeling or pain when urinating, having to urinate often, a strong, lasting urge to urinate, back, side or groin pain, nausea and vomiting, pus or blood in the urine, urine that smells bad or is cloudy, belly pain. What are the causes? Bacteria that enter the urinary tract through the urethra can proliferate and spread to the kidneys. This is the leading cause of kidney infections. Bacteria from another part of the body can also enter the bloodstream and reach the kidneys. In rare situations, infection of an artificial joint or heart valve might result in a kidney infection. A kidney infection occurs only in rare cases following kidney surgery. What are the risk factors? Factors that increase the risk of a kidney infection include being female. Women's urethras are shorter than men's. This allows bacteria to migrate more easily from outside the body to the bladder. The urethra's proximity to the vagina and anus makes it easier for bacteria to reach the bladder. A bladder infection might extend to the kidneys. Pregnant women have an even increased chance of developing a kidney infection. Having a urinary tract blockage. Anything that slows the flow of urine or makes it difficult to completely empty the bladder increases the risk of a kidney infection. This involves a kidney stone, a constricted urethra, and an enlarged prostate gland. Having a weak immune system. Diabetes and HIV are two medical disorders that can damage the immune system. Certain medications might also reduce immunity. These include medicines administered after an organ transplant to avoid rejection. Damage to the nerves surrounding the bladder. Nerve or spinal cord injury might impair the sensation of a bladder infection. This can make it difficult to determine when an infection spreads to the kidney. Using a urinary catheter. Urinary catheters are tubes that remove urine from the bladder. Catheters are occasionally utilized following a surgical procedure or diagnostic test. They are also utilized by persons who are confined to their beds. Having a condition in which urine flows the incorrect way. Vesicoureteral reflux occurs when little volumes of urine flow back from the bladder into the tubes that link the bladder and kidneys. People with this syndrome have an increased chance of developing kidney infections as children and adults. What are complications? If left untreated, a kidney infection can have possibly fatal complications, such as kidney scarring. This can cause chronic renal disease, excessive blood pressure, and kidney failure. Blood poisoning. The kidneys filter waste from the blood and return it to the body. A kidney infection can transmit bacteria throughout the circulation. Pregnancy problems. A kidney infection during pregnancy increases the likelihood of having a baby with a low birth weight. What are the preventions? Drink fluids, particularly water. Fluids can aid in the removal of microorganisms from the body when you urinate. Urinate as soon as you have to. When you get the urge to urinate, do it right away. After having sexual intercourse, empty your bladder. Urinating as soon as possible after sex helps to remove bacteria from the urethra. This reduces the danger of infection. Wipe carefully. After urinating or having a bowel movement, wipe from the front to back. This helps to keep bacteria from spreading to the urethra. Avoid utilizing products near the vaginal area. Deodorant sprays or douches in the vaginal area might cause irritation. When to visit a doctor. If you are experiencing kidney infection symptoms, schedule an appointment with your doctor. Also, consult your doctor if you're being treated for a UTI but your symptoms aren't improving. A severe kidney infection can cause serious problems. They may result in blood poisoning, tissue damage, or death. If you develop kidney infection symptoms such as bloody urine, nausea, or vomiting, see a doctor straight soon.